right. Jaw pain. Open your mouth for me. Well, he has TMJ. Is clicking, right?
Yes.
Popping in the jaw, right?
Mm-hmm. Yes.
It's on the right side. Now, when we go and when we start adjusting his jaw, that can open up a can of worms. That can really create a lot of problems. So first I start with treating the pterygoid muscles inside the jaw, the masseter. So we lasered the outside of his jaw on the side, the TMJ joint. And now I'm going from the inside and I'm lasering some of the muscles in there, the pterygoid muscles, lateral and medial, and reducing inflammation, reducing muscle spasms in there. And then we just adjusted his neck as well, and that helps to reduce a lot of tension in the jaw. So he started out having neck and jaw pain, and that can come from a lot of things, lifting something heavy, whiplash injury, an accident, a lot of different things. Even just sleeping on your neck wrong or taking a blow in a football game. But we're not sure what caused his, right?
No.
I'm saying that he's got a laser in his mouth, kind of hard to answer. But so that's what we're doing here with the jaw. Then sometimes I'll even go in with my finger and release the muscle spasms and the pterygoids with my finger, glove on, and put my hand in the mouth. Today we're showing you how we do it with laser therapy, and this is much more effective because it reduces inflammation and pain as well. It's going to reach all the way back into his TMJ joint too. It's going to go through the muscle tissue and into the joint itself, the way that I have it angled right here. So he's getting a sort of, in a way, a couple treatments: reducing inflammation, reducing muscle spasms, reducing pain, all in one. Can't beat that. When I put my hand and my finger in there, that really just reduces muscle tension, and it's more temporary than this one. So as I said, his jaw pain, he has clicking, popping, that's called TMJ. There are exercises we give patients. We did a great video on that, exercises for TMJ. There's like 20 of them in there. They're great. They're excellent. And they will fix the issue, even if you have a little bit of bruxism or overbite. Do you clench your teeth and grind?
Yeah.
Yeah, so he's got a little bruxism as well, and that's probably why these muscles here are so tight. And then it's kind of radiated into his neck, or vice versa. And each laser is different depending on wattage of the laser, just depends on the treatment times. So a lot of people ask me that. How long should I laser it for? My doctor only did it for a minute or 3 minutes. Each laser is just, this is a super pulse laser, so it's just so many different factors. I couldn't possibly answer that. And you'll see here I'm getting it from a couple of different angles. You okay there?
Yeah.
These are all somewhat tender spots.
Yeah.
Up there.
Yeah.
So we got a minute left, and we're going to just finish up the last minute here. And as I said, I also lasered from the outside of the TMJ along the side of his face as well. And we adjusted his neck. If you guys have any questions, first I guess I would start with some of the exercise, that jaw, the TMJ exercises. That video's got some massages in there and some stretches for the jaw. That's a good place to start. If it continues, you may need something else like manual therapy in there or laser, and then as a last resort, adjusting of the jaw. And we have done videos of that as well, adjusting the jaw, but again, we don't want to open up a can of worms. I'm real careful before I start doing that. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.